It is 6:44, and on the 8th of every month, we want you to call your buddy and remind them to do their breast self-exam. Denise Valdez has today's Buddy Check 8 report.
With so much going on in the world, it might be easy to forget to take care of yourself. But monthly self-exams and annual mammograms are the best way to stay connected to your body and notice any kind of changes. With over 25 years of experience, Dr. Terry Quinn McLaughlin is an accomplished breast cancer surgeon committed to making sure that her patients get the care they need, especially during a global outbreak.
Are you running into women who maybe feel a little lonely, feel a little isolated?
Well, yes, we are running into that because this is the COVID generation and we're all feeling lonely and isolated. And then if you add a layer of a new diagnosis of breast cancer, that might just be the straw that breaks the camel's back, so to speak.
But if caught early, breast cancer is very survivable. Dr. McLaughlin stresses when it's time for your mammogram, go somewhere that does a lot of them.
Just be sure that you go to a high volume place, a place that does a good number of mammogram screening, whether it's digital, traditional 2D, or the 3D. Who is reading them and the skill of the mammographer is still the best determinant about which cancers get detected.
But how do you know that, right? You have your insurance card, they give you the slip to go to a particular lab. I mean, how are you going to know that your radiologist has looked at dozens of mammograms and is really the right person to diagnose your x-ray?
You wouldn't necessarily know that. However, there are some specialty centers that are geared towards high volume situations. They are known as with the Women's Imaging Center, and that's all they do is mammograms. They don't do lungs, and they don't do knees and backs and so forth. So usually they're going to be the specialty centers.
Now there are specialty centers right here in Southern Nevada and plenty of places that also offer 3D imaging as well. Now mammograms are covered by insurance, but for uninsured patients, a mammogram typically costs between $80 and $200.